Hello everyone, I am Dr. Vishesh Gupta in Department of Conservative Dentistry and Endodontics, BBD course, Lucknow. I am here to present my topic on bleaching. What is bleaching? It is the lightening of the color of a discolored tooth through the application of a chemical agent to oxidize the organic pigmentation present on that tooth. Now, what is the classification of a bleaching material? There were three generations. First generation, the bleaching material was supplied as a liquid form. Second generation material was supplied as a viscous gel form. Third generation material was supplied again in a gel form, but not as thick as or not as viscous as supplied in a second generation material. Basically, the bleaching materials are supplied as home takeaway kits or professional in-office kits. The common example in front of you in the figure is Polo Office Plus, which is an in-office system, bleaching system, and Colgate White is an home takeaway kit. Now, what components makes a bleaching material? These are active agent that can be peroxide based or non-peroxide based. The peroxide based active agent can be carbamide peroxide or hydrogen peroxide. The non-peroxide active agent is sodium perborate. Along with active agent, we have thickening agents, stabilizers, vehicle surfactants, preservatives and flavoring agents, and fluorides that can be optional depending on the company to company. Now, the first active agent is carbamide peroxide. It is 10% aqueous solution or gel in the home bleaching kit, whereas we have 35% solution or gel of carbamide peroxide in-office bleaching kits. It has a pH of 5 to 6.5. The carbamide peroxides break down into solution of hydrogen peroxide and urea. The second active agent is hydrogen peroxide. It is available as 30% solution of hydrogen peroxide by weight in a pure distilled water. It is commonly known as superoxole. It is a colorless, odorless liquid. It is always stored in light-proof bottles or amber-colored bottles as it is unstable and may explode on heat. It causes ischemic effect on the skin and mucous membrane, thus resembling a chemical burn. The hydrogen peroxides break down into water and nascent oxygen. Next active agent is sodium perborate. It is a stable white powder which is water soluble. It decomposes into sodium metaborate, hydrogen peroxide, and nascent oxygen. Sodium perborate preparations are alkaline in nature. The bleaching process to gain desired shade is most easily controllable in case of sodium perborate treatment procedure. The material of choice as a sodium perborate is for walking bleach technique. It is a technique which we'll be covering in later slides under non-vital tooth bleaching system. Next, thickening agents. There are two thickening agents, carbopol and pollex. The carbopol releases oxygen slowly, and this slow release of oxygen needs replenishment after a time. This carbopol also enhances the viscosity, which allows a better retention of the gel on the bleaching tray. The common example of bleaching kit which has a carbopol is opalescence by Ultradent company. Next, Pollex is incorporated in Colgate Office White bleaching kits. This is a home takeaway kit which has Pollex in it. Next, coming to stabilizer, urea acts as a stabilizer. It breaks down into ammonia and carbon dioxide either spontaneously or through a bacterial metabolism. Urea is used to stabilize the hydrogen peroxide reactions. It also elevates the pH of solution. It has an anti-karyogenic effect. Next comes vehicle. Dentifrice is commonly used as a vehicle in the bleaching kits. Next is surfactant. These are the agents which act as the wetting agents which allow a wider penetration of a bleaching agent across the gel tooth interface. Next comes pigment dispersants. These keeps the pigment in the suspension form, thus making the bleaching gel very active. Next component is preservatives. The common examples of the preservatives are citric acid, phosphoric acid, and sodium cyanate. They take the custody of metals which accelerate the breakdown of hydrogen peroxide. They provide better durability and shelf life to the bleaching system. Next comes the flavoring agents. They impart flavor and improve the patient acceptance. The common available flavors are cranberry, melon, strawberry, banana, and mint. Now, the most important part. What is the mechanism of bleaching? Let's see. First of all, upon degradation of an active bleaching agent, there is release of a nascent oxygen, which acts on the unsaturated bonds in the high pigmented carbon ring structures. This further upon the bleaching, the rings of these carbon structures opens up and becomes linear, which are much more lighter. On further bleaching, it gives light pigmented unsaturated structures. On continued bleaching, it comes as a hydrophilic non-pigmented structures. Whenever we get the hydrophilic non-pigmented structures, this is an indication that we should stop bleaching, or we can say it is a saturation point. The bleaching should be stopped at this point. On continuing the bleaching over this point, there will be a breakdown of enamel matrix, thereby decomposition of molecular structure. On further progress of the bleaching, if we do bleaching, then there will be a complete loss of enamel matrix structure. On further bleaching, we will get a tooth brittle and porous. It will become brittle and porous. Next, now what are the bleaching techniques we do in clinics? These are divided into two subheadings, for a vital tooth and for a non-vital tooth. For a vital tooth, we have home bleaching, commonly known as night guard bleaching, also known as dentist prescribed bleaching, or also known as matrix bleaching. Next bleaching technique for a vital tooth is in-office bleaching, which is also known as chairside bleaching or power bleaching. Next technique for vital tooth is Grossman's method or Mackin's method, which is discontinued right now. Next vital tooth bleaching technique is modified Mackin's method. Next bleaching technique for a vital tooth is microabrasion bleaching. Now coming to the non-vital tooth, we have two techniques, that is intracorneal bleaching or commonly known as walking bleach technique, and second is thermocatalytic bleaching. Now we will deal first with the non-vital tooth bleaching techniques. First is the home bleaching technique, night guard technique, or dentist prescribed bleaching or matrix bleaching. Now here, what is the bleaching material? It is 10% carbamide peroxide solution. Here, the vacuum formed trays are constructed which have reservoirs on the labial surface of the desired teeth to be bleached. Reservoirs are nothing but a shell. It is a gap in which the bleaching agent has to be added when the patient wears that tray. This vacuum formed tray is made up of ethyl vinyl acetate sheet. The sheet should have minimum thickness of 0.035 inch. The tray and the bleaching materials are given to the patient so that he can bleach the teeth at his home. Next, what is the procedure we follow in this technique? The 5 drops of bleaching solution are to be added into the reservoirs of this each teeth to be bleached in the vacuum formed trays. The patient is very well instructed to wear it for minimum 12 hours a day. After 2 to 3 hours, the bleaching solution should be replenished or it should be changed. The patient is recalled after a week for the desired shade matching. The bleaching procedure is continued until the desired shade is obtained. Next, you can very well appreciate on the pictures. First picture is a pre-bleaching picture. That means the home bleaching treatment has not been commenced. The lower picture is after the home bleaching technique was done for a 3 weeks period. The appearance of teeth you can very well appreciate on these pictures. Next technique is in-office bleaching technique, or commonly known as power bleaching technique or laser bleaching technique, chair-side bleaching technique, or dentist applied bleaching technique. Here what bleaching agent is used? Either 30 to 35% of hydrogen peroxide can be used, or 35% carbamide peroxide. The bleaching material here is applied on the labial surface of the teeth and is then activated by a source. That source can be heat source, light source, or a laser. For severely stained teeth, we require acid etching of that particular tooth for approximately 5 to 7 seconds using 37% orthophosphoric acid to increase the penetrability of the bleaching material onto the tooth. We do this. In the picture, you can very well appreciate that number one mark is a gingival dam, liquid dam, that seals the space between the gingiva and the tooth. Second number mark with the blue color is all the bleaching material that is present on the labial surface of the tooth. And third is the light source or the heat source or the laser source, which is used to activate this process. Now, what are the various light sources we can use? First is the conventional bleaching light or the tungsten halogen light, which was coming under conventional light cure guns. It initiates the chemical process that causes vigorous release of nascent oxygen, which subsequently degrades the organic pigments present on that tooth. It is a slow and time-taking process. It is often uncomfortable to the patient. The application time for this source is 45 to 60 seconds per application per tooth. Next comes the xenon plasma arc light. It is a non-laser light with a high intensity. It produces more heat. It is applied only for 3 seconds because if it is applied for more this time period, it will generate a lot of heat that will cause pulp irritation and trauma. Next, the argon laser light. Its action is to simulate the catalyst in a chemical rapid treatment. Its application time is 10 seconds per tooth. Next comes the diode laser light source. This is the laser, but it does not produce heat. It is ultra fast, so the application time comes to 3 seconds to 5 seconds per tooth. Next, coming to the Grossman method or old Mekin's solution method, which is discontinued nowadays. The solution was prepared in a clean Depend dish. Its constituents were aesthetic uh, diethyl ether 0.2 ml 1 part, hydrochloric acid 36% 5 parts, hydrogen peroxide 30% 5 parts. Here the diethyl ether worked as a solvent and stabilizer. Hydrogen peroxide bleached the enamel, so it was a bleaching agent. Why it was discontinued? Because it produced excessive calcium destruction as we are using hydrochloric acid 36% in this solution. That's why it was discontinued. A new modification was proposed by the name modified Mekin's solution, and hence the treatment name comes from this, the name of the scientist. Its components are aesthetic diethyl ether 1 ml, sodium hydroxide 20% 1 ml, which makes the solution alkaline as compared to the old Mekin solution where hydrochloric acid was present. Next comes the hydrogen peroxide 30% 1 ml, which is a bleaching agent. Now, what is the technique? How do we go for it? After complete oral prophylaxis, the tooth is polished with a prophylactic paste. We protect the gingiva by coating Vaseline over it. Isolation of teeth to be bleached is done by a rubber dam. Enamel is etched for 45 seconds by 37% phosphoric acid. Freshly prepared solution of the mix is applied directly to the enamel surface for at least 5 minutes, and thereafter it has to be replenished after every 1 minute interval. The procedure can be repeated up to 2 to 3 times till the desired shade is obtained. Next, we come to the microabrasion bleaching technique. It is done in vital tooth. Here the name suggests microabrasion. Micro means microns. So in this technique we are removing 25 microns thickness of the enamel surface which have a discoloration on it. It is useful for elimination of white or brown spots or stains. Here 18% hydrochloric acid and pumice mixture is used in this technique. The mixture is applied on the tooth's labial surface. It is rubbed for 10 seconds using a rubber cup attached to the slow handpiece, preferably the micromotor handpiece. Next, the rubbed surface is rinsed with the water. The desired color is checked. The process is repeated if the required shade is not obtained. After obtaining the desired shade, the teeth are rinsed thoroughly under the water and are neutralized with the sodium bicarbonate. The teeth are then finally polished by fine fluoride containing prophylactic paste. Now here all the vital treatment bleaching procedures are over, and now we begin with the non-vital bleaching techniques. First we will come to intraocular bleaching technique, or also known as walking bleach technique. It is always done in a non-vital tooth which has gone under RCT. Prior to the start of this bleaching, we will evaluate the crown and the obturation status. First of all, we will do the oral prophylaxis. Then we will isolate that tooth with a rubber dam. We will remove the temporary filling, if any, to reach the pulp chamber. We will remove all the debris or root canal filling material or the root canal sealer lying on the pulp chamber. Next, we remove 2 to 3 mm of gutta percha from the underlying orifice of the root canal. After removal of this gutta percha, we place a protective barrier of resin modified glass ionomer cement of minimum 2 mm increment. We will now take the bleaching agent. How we will prepare the bleaching agent? We will take a pinch of sodium perborate powder, which was a white powder. We will mix it in a hydrogen peroxide solution to get a thick mix consistency. We will place this freshly prepared mix with a carrier over that GIC increment which we have given, and we will further condense it with a condenser. Next, we will cover this mix with a wet cotton pallet and close this cavity using a cavet or temporary restorative material IRM. We will leave this mix for around 5 to 7 days or until the patient notifies a definite color change. We will repeat the same process till the desired shade is obtained. Finally, we will replace this cavet or IRM placed with a final restoration, that is composite. Next, thermocatalytic bleaching technique, which is also done in non-vital teeth. Here the procedure is same as per the walking bleach technique, but the bleaching agent here is superoxole instead of sodium perborate which we use in the walking bleach technique. What is superoxole? Superoxole is 30% solution of hydrogen peroxide in a pure distilled water. We will place or we will introduce this agent over the protective barrier of 2 mm of resin modified GIC with a syringe. We will heat this superoxole with a bleaching wand. Bleaching wand is nothing but a stick which gives a heat source. It is a heat source stick. How much time we will take to heat? Minimum 2 minutes we will heat it until the bleaching material evaporates completely. We will heat the bleaching superoxole material, and until it evaporates, we will keep heating it with this wand. We will replenish the superoxole again and then repeat maximum for 3 times. We will now finally rinse the teeth with the water and place cavity. We will send back the patient and recall him after a week just to assess the color change, what it happened. This completes the thermocatalytic bleaching technique, and I conclude this lecture. Thank you all for patient hearing.